It's Saturday morning, 10 a.m. We're going to talk about neck pain and what you can do about it. And we're going to help you understand how neck pain occurs, why it may or may not go away, even with your best intentions and your best quality of care. So we're going to talk about how to get back to normal without unnecessary medications, injections, or surgeries, which is a common pathway that you might go on if you have neck pain. So I want to talk about a little bit about an anatomy of the neck without getting into too much unnecessary detail. But I think it is important to know the structure of the neck and why things go wrong. So I'm going to start out here with just the bones of the neck. Of course, you can recognize that this is the skull. But just underneath the skull, we have the neck bones, cervical spine. After the cervical spine, we have the thoracic spine and the mid-back. And you can see here, this little thing right here floating in midair, that's the hyoid bone. You can see right here, this is the shoulder blade. Coming off of the shoulder blade is the acromion process that articulates with the collarbone, clavicle. The clavicle goes up front, attaches to the sternum right there, breastplate. Also attached to the shoulder blade or the scapula is the arm bone, the humerus, that's a ball and socket joint. Back up to the neck. The neck holds up the skull. The neck is the attachment between the rest of your body and your head. It's made up of 7 different segments. Coming from the bottom, we have C7, C6, 5, 4, 3, 2, and 1. C1 is called the atlas bone, and it's a ring-shaped structure. C2 has this process that goes up like that, and the atlas pivots across it. And so when you look at this, if we were the designer of the body, we wanted more stability, we'd have like one bone in there. And maybe we'd allow a little bit of pivoting motion in the neck for the head, and maybe a little hinge down here to go up and down. However, the neck is much more flexible than that. The neck allows us to go into full flexion, full extension, side bending, rotation. It's got a really wide range of motion. If you compare that to the low back also has a lot of range of motion too. But the low back, you might be able to bend down 90 degrees. You might be able to extend 20 degrees, side bend here and there, and rotate, which is pretty amazing too. But the low back is more for weight bearing. It's got limitations. The neck is mostly not weight bearing. It just holds up the skull. But it's got more important jobs to do. The neck, along with the rest of the spine, the largest balance organ in the body. All kinds of nerve signals go from the articulations in the neck back into the brain and the balance centers to help you become more balanced, more stable in space. The neck has to have lots of range of motion, so you can look over your shoulder, and it's got to be fast too. You need to be able to whip your neck over your shoulder to see what's coming. More importantly, the neck holds up the skull, which houses the brain. The brain goes down into the brainstem, and that goes down into the spinal cord. The spinal cord travels through this canal that these bones form, and the neck has to have all this flexibility, but at the same time it needs to protect the spinal cord. Because if something damages the spinal cord, that's when you become paralyzed. And if it's high enough, that's when you lose your ability to breathe, or you decapitate yourself neurologically. So it's got to be stable, it's got to be flexible, it's got to protect the nerves, and it's got to protect the blood vessels. I'll show you the blood vessel picture in a second. But all the blood from the rest of the body has to get pumped up into the brain, and that travels along outside the neck and also inside certain parts of the neck. So the neck has a lot of important jobs to do. Oh, by the way, every time you breathe or you swallow, food has to go down the esophagus into your stomach, and the breath, the air that you breathe, has to go down the trachea, which also involves the neck. So we need to protect your neck. Let's take another look at here. We looked at the bones. Now we're adding some ligaments. Right here you can see that your neck has intervertebral discs, just like your low back does. There's a disc providing a little bit of space between the bones. These discs also provide some flexibility. So if you have good, healthy discs, then you can move your neck with more range of motion. Once those discs become unhealthy, you start to lose range of motion. And along with the discs, we've got other ligaments. Here's another look. These are very important. So we rotated the guy this way just a little bit so we can get a little bit of a view of the back of the neck. We're looking at the articular capsules. So all kinds of joints in the neck. Up front we have the vertebral bodies, the main part of the neck bone, sitting on top of another neck bone with a disc in between. Behind that, and behind the spinal cord, we have these articular joints, these facet joints, zygapophyseal joints. They have a capsule that surrounds them, just like you have a capsule that surrounds the joints in your fingers. A lot of neurological information comes from these capsules, but they can also become damaged in whiplash injuries or other kinds of neck injuries. And so they provide some stability too, to a small degree, but mostly they provide a lot of neurological feedback into the muscles that also sit in the neck. So these are very important structures. These are also very important structures for neck pain. Whether you have a new injury or an old injury, these joint capsules become damaged a lot, and they're very vulnerable to injury. Also, surrounding the spinal cord, providing a canal for the spinal cord, is a ligamenta flava. The ligamentum flavum provides some flexibility because they have elastic fibers. So when you bend down, you'll have some range of motion in the back of your neck. But it's also very important for protecting your neck, but it's also an important structure for injury. So now we take a step back and we can look at all the small muscles in the neck. These right here are the interspinous muscles. We have the intertransverse muscles, and we've got the longer muscles, longus colli. Colli means neck, but they're the long muscles here. Small, intricate muscles in the upper neck that allow you to rotate your neck around, giving you more range of motion. So you don't need to know the names of these muscles, but I want you to appreciate how intricate the design of the muscles in the neck can be. So these are the very smallest muscles in your spine. We put another layer in there. We've got these muscles that go from 2 or 3 segments down or up. And these muscles are designed to provide more shunt stabilization. These are your postural muscles. They're tonic, not phasic. A phasic muscle is a muscle that provides fast movements to lift weights, but a tonic muscle is a postural muscle. These are the muscles that are responsible for holding up your head. They're also really close to the center of the bones, so they have a lot that allows them to become more and more efficient for holding the neck up. These are muscles that don't fatigue very easily, but these are muscles that can become injured in a whiplash injury. So if you have a new whiplash injury, these muscles can become sore, achy, inflamed. You don't want anybody to touch them, at least for a few days. This is where you need to have ice therapy or maybe electrical stim to provide a soothing massage to these muscles. Putting another layer in there, the muscles become bigger. They're also phasic, they're also tonic, not phasic. providing postural support for the whole head and neck. They're more and more involved with movement, though, the more we go out. So this is the longus capitis, providing a lift for the skull and for the rest of the neck. These are the scalene muscles that are accessory muscles for breathing. So if you have to breathe hard, they're going to lift your rib cage up. These are also the muscles that can become tight when you're working at a desk for long hours at a time, and your neck muscles start to become more and more achy. We can also see the rotator cuff muscles here, supraspinatus, infraspinatus, teres minor. These are the muscles that provide support for the shoulder joint. This is the subject of earlier workshops, and if you look at my YouTube channel, you can see another workshop that I did for those. Also between the ribs, you can see the intercostal muscles that help you with normal, shallow breathing, normal breathing. Oh, adding more and more muscles here. Now you can see how they can become more involved with rotation, so you can look back behind you. And of course, this is the trapezius, upper trapezius, middle trapezius, and lower trapezius. The trapezius muscle is a notorious muscle for trigger points. So you can go along someone's shoulder and start to, just kind of grab onto the trapezius muscle, pressing into the trigger points. And it usually feels a little bit achy, but it also feels good. So the trapezius muscle is vulnerable for developing trigger points, especially with people who have fibromyalgia. All right, so the neck, much more than just a part of the body that has muscles that move bones. And it's even much more than part of the body that has the nervous system attached to it. You can see the blood vessels right here. These are the arteries that come from the heart, go down the arm. They also branch off and go up to the skull to bring blood flow to the brain. Carotid artery, vertebral artery. The body is incredibly resilient. You can have problems in your neck and the muscles in your neck, and these arteries still continue to work well to bring blood flow back into the brain. I have recently discovered, by watching experts in the field, that sometimes you can develop problems in the neck that will compress the vein that drains blood from the brain, and that can create back pressure into the brain, causing all kinds of neurological problems. So we're looking more and more at that. You can do an ultrasound imaging study of the vein coming down, and that can look backed up on one side but not the other. But to underscore the point, the neck has a really important job to do of feeding blood to the brain and then draining it back out to the heart and lungs. Here's a back view of the neck, and you can see how the spinal cord comes down. And you can see where the nerve roots come out of the spine, out of the neck, and they go down into this brachial plexus, a plexus of nerves that feed nerves back down to the arms. And so if you have a compressed nerve at the lower part of the neck at C6, that is going to create numbness and tingling in this part of the hand. Compressed nerve a little bit lower is going to go into this part of the hand. Compress the nerve a little bit more, and maybe it's into the pinky or the inside of the arm. So, neurological connections are a very important part of the way the neck works. So let's talk about injury. This graph here, this illustration, shows an injury to the muscle, the ligaments or tendons, and the bone. Now, if you break a bone, the bone has a really good blood supply, so it heals fast. You break a bone, the blood is right there, the stem cells for blood. It immediately bridges the gap, immediately, like a few days. And then it creates a matrix which grows new bone on top, and the bone becomes even stronger than what it was before. Muscles and tendons are a little bit different. Now, here's the thing I like to use to illustrate this. This is an exercise band made for exercising like the legs to grow hip muscles. So if you take a look at this band, you can see the fibers in there. These fibers, if you pull it and you take a little microscopic view of the way the tendons work, you can see that these fibers are designed to go in a longitudinal direction, but they're not made to decompress this way. They're not made to be compressed this way. They are made to go in this direction. The tendons and ligaments are kind of like the same way. The tendons and ligaments in your neck or in your arms or whatever part of your body, they're made for a tensile stretch. And if you damage a ligament, the best way to rehab it is to provide a constant or near constant load on those fibers, so that load is going to stimulate the cells inside the tendons to lay down new fiber and remodel the direction that these fibers go. This band is getting kind of worn out, but in your own body, the cells inside the tendon will actually help you scavenge these loose ends and lay down new fibers. We're going to talk about how that happens too. So if you look at the healing process between muscles and tendons, you might have a tear in the muscle or a tear in the tendon. Well, immediately your body is going to start to inflame the area to immobilize it. Active inflammation, swelling, pain. Pain is there to guard and protect your body in the event of a new injury. Well, then a blood clot goes in there. It forms in the torn area. The blood platelets in the blood are attracted to the loose ends. That blood clot is going to send a signal out for new cells to come in to take residence in that area. It's going to form a matrix of new collagen fibers. That matrix of new fibers is going to attract more and more fibrocytes to develop the fibers that make up muscle cells and the fibers that make up the body of the tendon. Eventually, over time, you'll be left with a callus, some scar tissue, but you'll have a stronger bridge between the two ends. And it goes through different phases of healing. So this is the acute phase right here. Acute inflammation might last a few days, 3 or 4 days. Active swelling, lots of pain, your body sending signals to avoid movement. The next stage is the proliferation stage. The proliferation stage is when white blood cells come in. First it's neutrophils, then macrophages, then lymphocytes. And then that sends a signal for more fibroblasts. Fibroblasts come in, fibroblasts create new fibers, creating that collagen framework to lay down more and more collagen. There's collagen right there. So over the course of the first month of healing, you're going to have inflammation, you're going to have proliferation. This is the acute stage of healing. And then we go into subacute, which is the remodeling stage, the beginnings of the remodeling stage. This is when you're developing more and more tensile strength. At first you have no strength. It's inflamed, you've got a tear, everything is shut down. You can't contract the muscle. Eventually you can start to contract the muscle. You go through the pain, you're really weak, but then 5 days later, you can start using your muscle more and more as time goes on. You're developing more tensile strength. You're also developing more function potential. So the acute stage of healing is like 4 weeks long. Subacute is another 4 weeks. And then you're in the chronic stage of healing, or better yet, the remodeling stage of healing, where your body is responding to that tensile stretch, and it is laying down new fibers. It's taking away the scar tissue that's been put in there, and it's laying down healthy fibers that allow for full strength and full functional capacity. Now this is only going through the first 45 days of the healing process. And then you see this cutoff line right here. We're looking at a year of healing in some cases, 365 plus days. This is for tendons and ligaments. I'm going to back up right here too. These are the tendons and ligaments they're talking about. If you have a whiplash injury, if you have another kind of neck injury, these are the ones that become torn the most, and they take up to a year to heal. Hard to work around that. If you have a whiplash injury, those capsule fibers are torn. You have to do what you can to introduce movement into that area as fast as you can. Like the poster says, movement is medicine. So we want to restore mobility as fast as we can. Restoring mobility is going to help the joint capsules out. It's going to help the other ligaments out within the spine. It'll help the discs. It's going to help promote better muscle growth because these muscles can become atrophied after an injury. It's going to prevent a gristle that gets deposited in the muscles in the form of scar tissue. Better movement does this. And it's not like picking up a heavy weight with these muscles to promote muscle contraction. It is watching your posture. It is, I don't know why it says 1 minute right there. It's watching your posture. It's allowing better flexibility in your whole neck. So those are the stages of healing after an injury, sports injury, illustrated here, but also whiplash injury that can affect the neck. Those are the stages of healing to expect. When you start a plan of chiropractic care or other types of conservative care, you have to plan out about 3 months of care at least. 2 months if you're really lucky and efficient. But that's going to allow you to go through the healing process of the acute stage, the subacute stage, and the chronic stage, remodeling stage of healing. When things get better, functional potential goes up, then you can have homework to do, home exercise program, a routine for mobility and strength that you can do. Now, if you have neck pain and the neck pain is not going away, here are 4 areas that work together that you should be mindful of. We have the neck, we have the collarbone, we have the shoulder blade, and we have the rib cage. So neck pain usually goes hand in hand with shoulder pain. If you have problems in the neck, you'll also have pain and dysfunction in the shoulder most of the time, especially as the injury process goes more through the long-term healing process, or you have chronic pain. Chronic pain in the neck can lead to chronic pain in the shoulder too. This will mess with your posture, so your shoulders roll forward and you have an impingement. This leads to deconditioning syndrome, where you don't use your stuff anymore, you have disuse atrophy, and that leads to more and more problems. That's going to lead to more tendinitis because you're not using the tendons by not lifting and by not doing activities. So the neck works really closely with the shoulder works really closely with the neck. If your shoulder blade posture is not in line because maybe you're slouching too much, that is also going to affect the neck. If you're slouching this way, your shoulders come forward, your neck is going to have a lot more stress on it. Muscles in the front, these scalene muscles get more and more tight. So if you have chronic neck pain, what you need to be mindful of is what your neck is doing, what your collarbone is doing, what your shoulder blade is doing, and what your rib cage is doing. These all work together. Rib cage is shorthand for the mid-back. People tend to slump in that area. That area becomes tight. The tightness in here is going to create more and more instability in the neck. So the important part of neck pain is your pain reproducible? Does your pain in your neck become painful when you are doing overhead reaching, or when you are carrying objects, lifting, reaching behind your back, getting dressed, or sleeping? If your pain comes and goes depending on what activity you're doing, then it is reproducible, and that's good news. Reproducible pain means that it's more of a mechanical type of pain. Pain that is always there, it doesn't come and go, it's intractable, that's more of a red flag kind of pain. That's pain where we need to do a deeper investigation of what's going on. But if your pain is reproducible, then we know that we can reduce the pain. Pain that is reproducible is reducible. And with some good conservative care, we can work on that. And of course, you're listening to a presentation by a chiropractor, and the chiropractor is going to do what he can do based upon the tools that he has in his office and his scope of practice to do conservative care to improve mobility in the neck, mobility in the mid-back, proper posture of the shoulder blade, good mobility of the collarbone, and the strength and coordination of all these muscles. This is the essence of conservative care. This is the way you avoid injections because a tendonitis forms. This is the way you avoid surgery 20 years down the road because degeneration sets in and it compresses the nerves. Conservative care is what chiropractic care is all about. It's also what good physical therapy is all about. Self-care by working out or working with a trainer, building up muscle, which helps improve posture, is also another form of conservative care. And I fully recommend that you are more proactive so the pain that is reproducible becomes reduced. And then eventually, with good care, reaching overhead becomes less of a problem, carrying objects becomes less of a problem, lifting, reaching, getting dressed, which involves full shoulder mobility, sleeping, which involves good muscle control of the neck at night. This becomes less of a problem because you're working on mobility, strength, and coordination. Now, if you have neck pain or shoulder pain or upper back pain, there are 3 basic ways to handle this pain. The first thing you can do is ignore it. And as you are coming up in the world in your 20s and 30s, this might have been the way that you got away with recovering from injuries, is by ignoring the pain. Now, the body is a self-healing organism. Your body never stops healing. It sort of like slows down as you become older, but you never stop healing. So with a lot of injuries in your life, you're safe to ignore it. Although you need to know when to not ignore it. And if you've been ignoring it and that backfires on you, it becomes chronic pain or unbearable pain, you might want to alter it with medications, taking drugs to dampen the pain, to put a fog, a blanket over the pain, which is also maybe another way of ignoring it, but at least when you alter the pain, when it comes to that, then you can make it through the day. But that's not what I recommend. I recommend handling it. Now, this illustration shows a guy doing an overhead press, which might be a little bit more advanced than what you were expecting. But handling it involves not only exercise, but it involves getting into care with a chiropractor to improve mobility in those 4 structures that are involved with neck pain. Improving mobility of the mid-back, improving mobility of the neck, strength of the upper back, strength of the shoulders. This is the proper way of doing things, is to handle it properly. Using the advice of a trained professional with experience. Could be a chiropractor, could be me, could be a physical therapist, could be a good conservative physiatrist, but you need to have someone who can guide you through the ways to handle it. What happens if you don't handle it? What happens if you just ignore the pain and it becomes a problem? Well, this is the cycle of injury and recovery. This is the event where your body becomes damaged and injury. This is the whiplash injury. This is the sports injury. This is a slip and fall. But when you become injured, you have pain. And the pain is threatening information. Pain is sending a signal back into the brain to stabilize and avoid further movement. This is appropriate, but there are two paths you can take after that. This pain can become catastrophized. You can be, catastrophization is when you overreact to what the pain is telling you, and this leads to fear avoidance, hypervigilance. You're avoiding any kind of movement because you are worried that you might re-injure yourself. Fear avoidance behavior is reacting too much, and this can lead to disuse. You stop using your shoulders to lift overhead. You stop turning your neck or bending your neck to the side because of fear avoidance. This leads to disuse. This leads to muscle atrophy, and this can lead to depression. Now you can see that this is a vicious cycle of re-injury, fear avoidance, disuse, re-injury, fear of re-injury, fear avoidance, and on it goes. But you need to avoid this part of the cycle and become more proactive. This is the case for a new injury, and this is also the case if you have chronic pain. Now with chronic pain, you have to avoid the catastrophization of the pain and have low fear, no fear, visualize wellness, and return to activity. When you return to activity, you are actively telling your muscles to provide tensile stretch on the fibers of the tendons and ligaments, and the muscles to build collagen fibers, build a signal to make your muscles stronger, more coordinated. The nerves are more active with coordination, and this leads to recovery. So avoid the fear avoidance model, become more proactive so you can recover better. This is the training effect. So if you become injured, maybe you have chronic pain, you need to start to learn how to train yourself to have better function, better baseline of function so you can live your best life from there. Now, if you have scar tissue in your neck and shoulder or wherever because of an old injury, you might have permanent damage. But you can take that permanent damage and do the best you can with what you have. And that is why you do this training recovery. Now, if you train too easy, you have slower recovery, but it's safe. If you train too hard, then you might re-injure yourself, and that actually leads to lower baseline of recovery. High overload, insufficient recovery, no training adaptation, risk of injury goes up. Sprain, strain, stress, fractures. That's training too hard. So you need to know how to make it just right and have optimal training. Optimal training is when you're injured, you recover because you're working out just the right amount. You don't go too early, you go just right, and you're telling your muscles to contract and coordinate to help provide that stretch on tissue. This sets up a new baseline, progressive overload, sufficient recovery, training adaptation, and improved baseline of function. So this is what I want for you. Here's what successful treatment looks like. Neck pain, poor mobility. You need to have better mobility in your neck, better strength. You want to have hands-on care. Now, I as a chiropractor, when I'm investigating somebody's mobility in their neck or their back, I can feel spots that are stuck. It just does not move very well. When you become adjusted, when you get adjusted, that helps restore the movement right away. It's an immediate, palpable difference where when you get off the table, you feel a lot better and you can move a lot better, better range of motion. This provides a good foundation for exercise and mobility care. This hands-on care, it's temporary. It's only a fraction of your day, but this sets up a good catalyst for the rest of the stuff that you do throughout the day, which includes exercise and mobility and watching your posture. Successful treatment might go through the course of a month for minor cases of pain in your neck, or it might go for 3 months or more in the case of a catastrophic injury like a whiplash injury. And it might be ongoing with continuous care that is not so intensive, but where you come in every once in a while for wellness care. That's what successful treatment looks like. Successful treatment is going to allow you to improve your baseline of function over time. Plus, it feels great. So I hope this has been helpful. When you come into my clinic is called Adjust.clinic in Petaluma, California. A first visit involves health history, like a medical history, orthopedic evaluation, checking to make sure that you have proper stability in your neck, good range of motion, or if you don't, then that's part of the diagnostic process. Neurological evaluation. Oftentimes when people have neck pain, they might have some numbness and tingling in the fingers, or maybe a problem with coordination. So neurological evaluation involves looking for that. If you mention this video, your first exam is going to involve using a digital posture evaluation. We have 3D cameras that measure posture, and so we can measure your posture just by standing and clicking a button. That's going to let us know that if your head has gone too forward, if your shoulders rolled forward, if you've got a rotation in your body. The digital postural evaluation is going to give us that information to let us know, and it's going to help us make better decisions on your care. We'll also do a digital balance evaluation. So digital balance evaluation involves having the camera in front of you, standing on one foot, closing your eyes, and we can see how much sway you have in your body and how stable you are. We do each foot for about 20 seconds each. The biomechanics software will graph that out and let us know how good your balance is. With more care, including the adjustment, and with your homework, we should see the digital balance evaluation improve over time, and we should see your posture improve over time. These tests are more for screening than they are for information gathering, but they're also important for function. But the postural evaluation, the balance evaluation, those are important for your functional improvement as illustrated here. So your first visit is going to include a chiropractic adjustment too. And if we find some red flags where we need to send you out for imaging, like x-rays or MRI, we have access to that too. So thank you for attending my presentation. I'm Dr. Todd Lloyd, chiropractor, founder of Adjust Clinic. And I hope if you live in the area, I hope to see you soon.